And good morning, everyone. It is time for another installment of The Chew with Dr. Drew. And in studio, of course, here is the man himself, Dr. Drew Markham. Welcome back.
Good morning.
Good morning. I heard you had a few days in Las Vegas.
Yes, I did.
But this was not for sheer entertainment from Las Vegas. You were there actually you were involved in a skills teaching? Or?
It just so happens that the facility where I've done most of my postgraduate training happens to be in Las Vegas. It's not downtown. And so I've been there many, many times, and I was fortunate to be asked several years ago to also come a few times a year to help teach some of the live patient courses that they do. So I was there for that last week.
Well, welcome back. While you were gone, it was a really eventful week. Mm-hmm. Last week on The Chew, we talked about one of the fears, or rather one of the reasons people don't go to see a dentist. And last week we talked about fear. And this week we're going to tackle a topic that could be a little tough for a lot of folks.
Absolutely. We're going to talk about money today.
That's it. And I know that in your line of expertise, this is not an inexpensive way to, take care of not just routine things, but, if people have hereditary issues with their teeth, and it can get expensive for some folks.
Absolutely. There are cases that cost tens of thousands of dollars that people will spend to rebuild their entire mouth. Of course, that doesn't mean that everyone falls into that category.
Right.
But with technology having changed, there's incredible opportunities that are out there. But yes, at the same time, the financial side of it is very difficult.
Now, there are many folks do have insurance, but as we talked about off air, a lot of that, what is available to families, the monetary value hasn't changed.
Absolutely.
For many of those insurance policies.
The one thing about insurance is that, the term insurance brings on certain connotations, but I think we try to talk about it in our office in terms of it being a benefit, that for those that do have coverage, that there is money to be able to put towards the cost of dental care. In some cases, it does cover everything, but in many cases, it doesn't. And so that's a challenge that we face every day. And one of the most common questions we get asked is, will my insurance cover that? And we don't always know, because there are literally thousands of plans. Each employer sets up a contract with that employer to determine what they will and what they won't cover. And to answer the question about the total value of the benefit, a lot of plans will have, say, $1,000 yearly maximum. Back in the 70s, many of those plans had the same $1,000 yearly maximum, which, adjusted for inflation, would probably be about $5,000 today.
Right.
But unfortunately, that's not the case any longer.
Well, I know for many years with my insurance, it was at $800 a year.
Sure.
And that was going in maybe a couple times a year to get your teeth cleaned and maybe fill a cavity.
That's right. And if you get anything more extensive than that, then you're looking outside of that plan in most cases, for sure.
Now, you mentioned a couple of weeks ago that there was a reason for the cost of, the cost associated with oral health care was because it's such a detailed procedure that you have to learn and continually upgrade on techniques.
Absolutely. I know that when I moved here 10 years ago to get my own practice, a big part of that was, committing to practicing in a certain way. And a lot of offices do the same thing, where they invest very heavily in the technology that they have in the office to help provide better care, but also in the training of their team so that they're able to deliver that care at a level that we think our patients deserve.
So when an individual has, let's say, an issue financially, but they really need to have it taken care of. It could be something that could not just affect their oral health, but their overall health.
Absolutely.
What is available for them to have these, procedures done, and then maybe be able to pay installment-wise or something? Or
in our office, we have a third-party partner that we work with that helps spread things out over time. Similar to what you would do, say, with a car or in some cases furniture, when you don't have everything available all at that one time.
Right. Or if you have a new baby suddenly.
Absolutely. Yeah. All kids going away to school, all sorts of different things come up in life. And so we do have a partner that we work with that helps for a lot of people.
Well, that would be a help for a lot of folks. Now, is there anything else that you could help to assuage our anxiety about, the financial aspect of having procedures done?
Sure. I think for a lot of people, especially when they maybe haven't been for a few years, there are several fears that they have in coming in. Number one, some people feel that they may have a mouth that's beyond repair. And if they're feeling that way, they probably feel that if it were able to be repaired, it would cost them the equivalent of a mortgage. And the truth is, we never know. But when you get right down to it, when you come to our office, it's our job to tell you what we see in your mouth. And we're going to tell you the good stuff, and we're going to tell you the stuff that maybe needs some work. But we're going to tell you, what the consequences are of different choices so that there's a best fit for everybody. And so, I don't diagnose or treat patients based on what they can afford, but at the same time, I'm not an idiot. I know that is absolutely a huge part of the equation. So, I have a treatment coordinator who works with the patients to find out what the best solution is for them.
And I guess, I am a layman, but I guess you do indeed get what you pay for. Is that right, Dr. Drew? I mean, if you want to have the best oral health, you need your expertise in order to achieve that.
It's true. And it's a difficult conversation in the sense that, dentistry and medicine are both healthcare related. And then, in Ontario, with benefits being covered from a medical standpoint, it's difficult to talk about things at different levels as far as oral health goes. But the truth is, I guess, that there's certainly a base minimum that we want to make sure that everyone has the ability to achieve. And then there are some things that are more want than need. And so, again, we try to help each patient guide their way through what's best for them.
Now, we talked about this in the past as well, but off air, we were talking about a dental practice that we know just north of here, where this man is an incredible, gentle, and caring dentist. And until I went to see this man, I was absolutely petrified. But he also helped to assuage my anxiety financially. He contacted the insurance company and said, "These are the things that need to be done. Will you cover them?" And they responded immediately because he was so kind about his offer. It wasn't like a demand. It was just saying, "This is what I suggest for this patient." And then they responded by saying, "Well, yes, we understand your reputation. We understand this needs to be done just to be able to get through life." It had nothing to do with my occupation at the time. And then through his caring and technique and kindness, I got through this procedure with a minimum of anxiety. And
Sure.
I think this is what you have been intimating the last few weeks.
Well, and certainly when it comes to the benefit side of things, all practices will send letters of support to help the insurance person make the determination as to what's covered. And because they often will ask questions, which, frankly, if you were to ask me, is generally to delay benefits, which makes things very difficult for patients. But certainly we advocate all the time on their behalf.
Yeah, and part of their practice as well is their actual aerial tables is what they're looking at. They're not the expert that you are in saying this person needs to have this procedure completed.
Yeah, insurance is not really, or insurance companies are not in the business of really caring about what the patient receives or doesn't receive. It's a business, and they're going based on a contract, and so they have defined terms as to what's covered and what's not. So very often there are absolutely legitimate treatments that are discussed that for one reason or another that employer has decided to not include as part of the contract. But that can also make things very difficult because insurance documents are very difficult to read, and so we certainly help our patients work their way through that.
Well, and that's one of the advantages to being in a new era of dental practice, is you taking the time to write these letters of support. And we mentioned a colleague of yours up north. I never knew that happened. And because of your commitment making that happen, then those procedures can be looked after, and take a little of the financial burden off to your client.
Sure. And when it comes to these issues, whether it be financial or treatment-wise, communication really is so important. And a lot of times there are things that are going on behind the scenes that the patient isn't aware of. And so we try to, open the back door, I suppose, and let people see what's going on so that they're aware that, there are challenges, but we're certainly working on their behalf to get through them.
Well, thank you for explaining the financial end of, a client going to see a dentist, and that there are ways that you can get that patient the treatment that he or she needs and without carrying this huge financial grab bag of cash in.
Sure.
Dr. Drew, this is the Chew with Dr. Drew. Thanks again, Dr. Drew Markham, for being here.
Thank
Dr.
you.
Drew will be back next week at 9:45